Motivational interviewing is a technique that we use to help clients move from ambivalence towards change. Today we'll be using the motivational interviewing technique of OARS, so that stands for open-ended questions, affirmation, reflections, and summarizing. We will be using two scenarios today. In the first one, we will use the traditional patient-clinician scenario, and the second one will be the patient-clinician scenario with motivational interviewing and using the technique of OARS. Jackie will be playing the clinician, and Kelly will be playing the role of the patient. Their patient is a newly diagnosed gestational diabetic who is wanting to make changes to better her baby's health. Pay attention to the differences between the two scenarios.
Good morning, Kelly. How are you doing today?
I'm doing well, thanks.
Great. So from looking at your chart, it appears you're here because you were just newly diagnosed with gestational diabetes. Is that correct?
That's what my doctor said.
Okay. Well, first of all, do you have any questions at all about gestational diabetes? Did your doctor go over it with you?
To be honest, I really don't know what it is. I went in for my normal lab work, and he said that this was just a normal test that you do at 26 weeks.
Mm-hmm.
And so it came back negative, and he said I have gestational diabetes and to come talk to a registered dietitian about it, but he didn't really get too much into it.
Okay. Well, to start, gestational diabetes is when you just have those elevated or increased blood sugar levels. And so essentially what that can do is lead to some complications down the road for both your pregnancy, for the health of your child, and it can also lead to, well, it does increase your chances as well of developing type 2 diabetes down the road. So what we kind of want you, or why your doctor kind of referred you to me, is so that we can discuss a little bit about what you're eating and how to control that, since it's very important to control diabetes and your blood sugars through your diet.
Okay.
Sound okay?
Sure.
Okay. So I kind of have this little form here. It's just a standard patient form. It's something that I go through with each of my patients. You might see me write down a few things as I go along as well. So do you have any, or can you tell me a typical day for you at home meal-wise eating?
I do try and eat all 3 meals. It's rare that I skip them. For breakfast, I usually have, we go to Sam's and get like a case of like those individual sized juices. So I usually try and have one of those with breakfast. Someone told me that juice is really healthy for you since it's made from fruit. So I try to drink one of those along with a muffin or some sort of like quick pastry type thing in the morning that's on the go. If I don't have time for that at home, I usually drive through somewhere. I have a Panera right by my work, so I'll either get a muffin or a bagel along with the juice, or go to McDonald's and grab a breakfast sandwich. For lunch, it is usually eaten out with coworkers. That just varies, from day to day, but I would say pretty standard. It's like a sandwich, maybe some fries or chips, and then I rely on dinner. My husband usually has something going when I get home. He'll do a bowl of pasta or pizzas a couple times a week just because they're quick and easy.
Okay. So it does appear that you're eating all 3 meals a day, which is great. Can you kind of tell me a little bit about the times that you eat those meals?
Yeah, so breakfast is usually eaten in the car, maybe around 7:30 or 8 in the morning. Then I don't really get a chance to eat lunch until around 1. That's kind of when it seems to be 12:30 or 1, the biggest time to take a break. And then we eat dinner around 6:30 or 7 at night.
Okay. And then do you snack at all in between those meals?
Very rarely during breakfast and lunch. Just don't seem to have the time. Sometimes after lunch I get really hungry, so I'll grab something out of the vending machine. I don't really have time to bring anything from home, or I kind of forget to, so by the time I get hungry I'm not really thinking about it, and I just go to the vending machine.
Okay.
And then I do like to have a snack right before bed. Usually I really like ice cream. It kind of helps me unwind, so I'll have a bowl of ice cream or a bowl of cereal.
Okay. So from what you, or that's all the questions I have for you, so from what we have, or what you have said, I have a few things I could probably recommend that you change at home, especially to help control that blood sugar and reduce those complications down the road. So, first of all, I would like to kind of say with the juice, you did say that you have that every morning typically.
That's correct.
Okay, and then yes, it is from a fruit, so it is healthy, like you said, but it's also highly concentrated with sugar, and it's better to get that fruit from a whole fruit instead of from juice. And so, especially with your gestational diabetes diagnosis, juice can really spike that blood sugar, and to help control that, it would be highly recommended for you to or completely cut out that juice and have something like water or milk instead.
Okay.
Do you think that's something you can do in the morning?
Probably.
Okay. Okay, and also on top of that, I did notice something that you said for breakfast as well. You went to Panera and you'd have a bagel or muffin.
That's right.
Okay. So those are also can be, since they're carbohydrate foods, they can spike your blood sugars as well. And so maybe having something with whole grain or a whole grain bagel or a whole grain muffin can reduce the spike because it will have fiber in it, which slows down the blood sugar
Okay.
for you. So like having a whole grain piece of toast in the morning or something like oatmeal. Is oatmeal?
Since I'm usually crushed for time, I'm not sure I like oatmeal.
Mm-hmm.
It's okay. So, but it's just about the timing in the morning, but it's something I guess I could try if it's for the health of my baby.
Okay. And especially since breakfast is the most important meal of the day, it is important to make that time for breakfast.
Okay.
So oatmeal and whole grain toast, like I said, and maybe cutting out the juice would probably be a good option for you.
Okay.
Okay. And then from what I can see with your lunch and dinner, you're not eating a very high amount of fruits and vegetables a day. Is that correct?
Yeah, I thought that I was, but after kind of, saying out loud what I have on a daily basis, it doesn't really sound like I'm eating very many fruits and vegetables.
Yeah. And fruits and vegetables, like you've probably been told many times before, they do have a lot of nutrients that are key for the health of your baby as well as for you. So making sure to add that to your lunch and dinners and even to your breakfast, even though they are on the go, would be key for the health of you and your baby. So I would recommend adding some more fruits and vegetables. Is that something you think you can do?
Yeah, I think so. I'm not a huge fan of fruits and vegetables, but again, if it's for the health of my baby, I could probably add some, maybe at dinner or something like that.
Okay. Yeah, and that would definitely help out with your gestational diabetes diagnosis. And
Okay.
so it appears that you have a couple of things that you can work on at home, like helping out or changing your breakfast to water, milk, and then having a whole grain food on the go, as well as maybe increasing your fruits and vegetables throughout the day.
Okay.
Okay. Well, that's our time for now. I know that your doctor did recommend having a few more times with me or meetings with me. Is that okay with you?
Yeah, he mentioned that he might want me to come back a couple of times. So I guess I'll talk to the secretary on the way out and make an appointment.
Okay, that sounds great, and I look forward to seeing you again.
Great. Thank you.
Okay, thanks.
As you can see in scenario 1, the clinician did a lot of the talking and the patient did a lot of listening. The patient was not given the chance to talk about changes she has already made or what would fit into her schedule, which is already busy. The clinician came up with the goals and the patient did not seem very motivated. You will see quite a difference in the scenario 2, where the OARS technique is applied with motivational interviewing.
Well, good morning, Kelly. My name is Jackie. How are you doing today?
Good. How are you doing?
Good, doing well, thank you. So can you tell me a little bit about why we're meeting today?
Yeah, so I'm 26 weeks pregnant, and my doctor had me take a glucose tolerance test, and he said that it came back that I had high blood sugar levels and that I was a gestational diabetic. He wanted me to talk to a dietitian to see kind of what I could do, to make my day better, but to be honest, I have already made so many changes, and that I was shocked that the numbers came back high. So I'm not really sure what I could even change or what I could be doing, because I feel like I'm already doing so much.
Okay. So, from what you've told me, you went to the doctor for your 26 weeks oral glucose tolerance test, and the results came back, and your doctor diagnosed you with gestational diabetes.
Yes.
And you've been making all these changes, and you don't understand, or you don't think that the numbers reflect those changes that you've been making.
Yeah, it's really frustrating.
I can see how that can be very frustrating.
Yeah, there's so many do's and don'ts in pregnancy, and, eat this and don't eat that, and I feel like I've been really trying to make all of these right choices since the week I found out I was pregnant, and so I was just not expecting that.
Do you mind if I ask you the changes that you've been making since you've been pregnant?
Yeah, so before I was pregnant, I would find myself maybe forgetting to eat a meal, getting so busy at work that I would just skip out or get busy in the morning and not eat breakfast. So ever since I found out I was pregnant, I eat breakfast, lunch, and dinner, and do try and incorporate some small snacks in the day as well.
Oh, well, it really sounds like you've been putting your best foot forward.
Yeah, and I know breakfast is the most important meal of the day, but I will admit my breakfast probably isn't the healthiest. It's usually on the go and a really quick item, probably a glass of juice in the car with a muffin, or if I don't have time to grab that, I'll just drive through somewhere and grab Panera, grab a muffin and some juice, or maybe go to bread company or go to McDonald's or something like that and get a sandwich.
So breakfast is the most important meal of the day, like you said, but with time and everything that comes in the way of the day, you find yourself having to do it on the go.
Yeah, and time is my biggest enemy. I find myself really crunched, especially in the morning. I mean, work gets busy, but the last thing I need is, my boss, mad at me because I'm late for work, and so sometimes I find myself just grabbing whatever's quick.
Mm-hmm. And you are very busy.
Yes, I am. And again, I don't want my boss yelling at me because I was late and didn't show up, but I know it's not a good excuse. Breakfast, I think, should just be an important part of my day, and I find myself running out of time, but that shouldn't be an excuse for an unhealthy breakfast.
Well, what are some things that you could be doing a little differently so that you can get that breakfast in that you would like?
I'm trying to think. I know my husband would love this. My husband actually gets up at 6 to take a shower, and then I hit the snooze button like 6 times while he's in the shower and sleep an extra 30 minutes and then wake up as he's kind of getting ready to go out the door. So I'm actually thinking I could maybe wake up at the same time as him and make a healthy breakfast while he's getting ready for work.
Yeah, so what you've said is that you could wake up, or how long is it?
It's about 30 minutes.
30 minutes?
Yeah.
So you could wake up about 30 minutes earlier in the day, or earlier in the morning, so that you can have a little bit more time to make breakfast, and your husband does wake up at that time.
Yeah, and I think he's always giving me trouble because I'm still sleeping, and so I think that would actually give us more time in the morning. I can make a healthier breakfast. It might save us a little bit of money, actually, thinking about it, because it would prevent me from having to drive through somewhere, and it would maybe give me some time to actually sit down and have a short conversation with him in the morning before he leaves for work.
Yeah, it would benefit both you and your husband.
Yeah, and it would prevent me from being late at work, too.
Well, so it sounds like that is something you could be doing.
Yeah, but it might be a little difficult. I do like to stay up really late at night, and I kind of binge watch Netflix. I find myself, we eat dinner around 6:30 or so, and then by the time we clean up the mess and get the house in order, I sit down to relax with Netflix, and next thing I know, I've been sitting there for a couple of hours and my husband's gone to bed, and then I wake up really tired. So I think to make this change, I would definitely need to go to bed earlier, because I don't want to lose out on any sleep that I'm getting. That's why I find myself, sleeping so late in the morning. So I think I need to cut down on my watching the TV before I go to bed, although it is relaxing.
Well, sleep is very important to you, it sounds like.
It is. I feel like that there's no amount of coffee in the morning that can get me through if I'm tired. So I don't want to lose out on that sleep, but I think shortening the amount of TV I watch and getting to bed would definitely help.
Okay, so on a scale of 1 to 10, how likely do you think you would be able to go to bed earlier and cut out a little bit of that Netflix time so that you can wake up when your husband wakes up and then make that breakfast?
I honestly, I feel like I'm at an 8 because it's something that I've actually been talking about doing with him anyway. And I think this is just the motivation that I need. I obviously want to do what's healthy for my baby, and I want to be healthy with my husband. And I think going to bed earlier and waking up earlier to make that breakfast would be a really good change for us.
So, from what I'm hearing, it seems like you will go to bed earlier. About, I don't know, cut out a little bit of that Netflix time to allow for you to wake up when your husband wakes up and then have that breakfast with him, and so you're not rushing to get to work and then have to eat on the way.
Yeah.
Does this sound like something that you said you would be willing to do?
Yeah, absolutely. My husband's really important to me, and I think he would like this change. He actually hates that I watch so much Netflix anyway because I end up complaining the next morning about how tired I am. So I think if he could see my efforts and, going to bed earlier and it really benefiting my gestational diabetes as well as, even saving a little bit of money with breakfast, I think that would be a really beneficial thing for both of us and the baby.
Yeah. Well, it definitely sounds like what your husband thinks is very important to you, and that these are some changes that you'd be willing to make for both you and your husband and also for your baby's health as well.
Definitely.
Yeah. Okay, well, I know that your doctor has told or has requested that we meet a couple more times to kind of follow up a little bit on your goals that you made and to see how that's coming along for you. Does this sound like something you'd be willing to do?
Yeah, I actually would love to follow up and check my progress. So I'll be sure on the way out to schedule an appointment with your secretary, but I know my doctor wants me to do it, but I really think it would be good to see what else we can fix.
Mm-hmm. Well, I look forward to hearing about how it goes for you.
Great.
Look forward to seeing you next time.
Thanks, it was nice meeting you.
Yeah, nice meeting you.
You will notice from the two scenarios above that they are very different in counseling style. Scenario 1 focuses on a more traditional style of nutrition counseling, where the clinician has an agenda to accomplish and does not let the client guide the agenda. Also, scenario 1 has the clinician making the goals and gives the client changes to make. The client does not come up with them on her own, which increases the likelihood that she will not follow through. The client seems very hesitant about all of the suggested changes and is a little concerned that they will not fit into her lifestyle. The clinician really does all of the talking and gets a lot of the information into a short amount of time, which can be overwhelming to the client. Scenario number 2 depicts a situation in which the client leads the conversation and agenda with the guidance of MI and the clinician. With using OARS, the method of MI, the client comes to one change that she thinks she can make along with the help of her husband. MI with the OARS method can help to create realistic, sustainable changes. It allows the client to get changes that they want to make and that they can make. You can grow changes as you move forward with the sessions, but coming up with 1 or 2 changes in a session can help create sustainability. You will also notice the position of the clinician and the patient in scenario 1 is distant and across the table. In scenario 2, they are closer together, creating an inviting experience. The client leaves motivated for change and does not feel overwhelmed. Remember to use open-ended questions, affirmation, reflection, and summary when using the OARS method in MI.